maybe we can go into the hormones and the testing itself. Estrogen is one of those hormones that anytime I put out something on estrogen, be it a minute long or something, I get, people agreeing, people completely disagreeing. It's one of
Yeah,
those hormones that riles people up, really. Um,
for
and so
sure.
maybe we can talk about that a little bit in terms of just breaking up the types of treatments that we have. What's the best way to monitor? And I'll let you kind of take it away from there.
Sure. Yeah, well, and I think it's important to start first
Then
with no HRT, because even
yeah,
that can get confusing.
that's right.
And estrogen is the most difficult because as you look at a hormone, let's just say profile,
Yeah,
estrogen is always on the side of there's not very much of it. So just
yeah,
as an example, I came from the world of saliva testing for, for several years doing lots of that.
mhm,
The amount of estrogen in your saliva is like 10,000 times less than cortisol.
mhm,
So cortisol is relatively easy to measure in saliva.
right,
Estradiol is very difficult. And so
yeah,
that just starting with how do I even know that you are either hormone sufficient or hormone deficient
yeah,
or maybe in a state of excess? And for that, we need the right tool. And
yeah,
that's where I ended up leaving the saliva model and well, I should say keeping
mhm,
saliva where it's strong, which is to tell a cortisol
of
story.
course.
But when you start telling the estrogen story, this is where we get into dogma. And the dogma says, now hold on, for cortisol, the reason saliva is really good is because you're measuring free hormone and that matters. And
Yeah,
then you move over to estrogen and you say, why would the same rule not apply? Well, conceptually it may,
yeah,
but it's so difficult to measure in saliva that you'll even see with due respect, saliva labs that are very good labs generally,
mhm,
where there's one in particular that comes to mind where the postmenopausal range is actually higher than the premenopausal range. And you just slow
mhm,
down and stop and say, no, wait a minute.
mhm,
That there's no way that's
yeah,
true in biology. Correct.
right,
What does that mean? Well, it means there's so much noise in the test that you're essentially just getting the same numbers for the
mhm,
hormone sufficient and the hormone deficient crowd. Whereas when you move over to our test or a really solid blood test, you find that the premenopausal women, on average, have 10 times more estrogen than the postmenopausal women. Now, that's a
right,
biological truth
yeah,
that you need the right tool in order to differentiate between, again, the sufficient from the deficient. So once we've come up with the right tool, and in
mhm,
that case, it would be either the Dutch test, which I think we've published data that says this is a really
mhm,
solid way to do it, or two, a blood test. And in that's where methods matter. And you want to make sure you're using LCMS instead of your sort of cheaper standard assay, which works
yeah,
great for cortisol,
yeah,
but not so well for estradiol. So now we've got a solid value on do you even need HRT? And then
mhm,
once that is true, then I'm a chemist. I'm not the right person to say what, I mean, I have my opinions, but what
right,
dose and what route of administration you ought to use. But patches, gels,
mhm,
creams, different things can be used. So then you enter into this new question of like what tools should I use to monitor it?
right,
And for me, I think um, there are scenarios for which blood testing can work well to monitor HRT. I think
mhm,
testosterone, it's a pretty solid option. For estrogen, the variable is does it go up and down quickly throughout the day? So
mhm,
for example, if I put a gel or a cream on, there's a pretty big bounce throughout the day.
yeah,
That's not great for blood testing, not because it's wrong, broken, whatever. It's just you're shooting at a moving target. And
right,
if you look at the published data on an individual level,
mhm,
it's not predictable. So, okay, that's not such a great idea. That's where the urine is a nice option to capture big chunks of time
right,
early and late in the day. And then that conceptually works really well. And so, what we've done is then published our data to show that the Dutch test does a really nice job of differentiating between those not on
mhm,
hormones, those on a low dose of hormones, like a 0.025
mhm,
patch or a gel cream equivalent
mhm,
0.05, zero point 0.1, which is more hormone than I would choose to use. But again, I'm a chemist. I don't get to vote
mhm,
on what you give
right,
your patients. But the point is that the test can differentiate. So just as an example, I had a friend who used patches. She
mhm,
hated it. She said,
right,
man, when I use a patch, I feel, and she starts to describe something that sounds a lot like estrogen dominance. I'm like, well, that's
mhm,
odd. So I tested her. And what do you know? She goes from, so if you're normal, you're here.
mhm,
Then you hit postmenopause, you're here. And when she put a patch on, she was
mhm,
responding way more than the average person. So, like, okay, I don't know why you're absorbing more estrogen, but this
right,
is a good tool to confirm what you've already concluded in how you feel. And now we can optimize your therapy, which means either A, lower the dose, or B, maybe for some reason a gel or a cream is going to work better for you. And so what we've done is tried to overlay the response of those products with the clinical data that's available that says, look, where do you need a woman to get in order to optimize bone mineral density, hot flashes, vaginal atrophy? Those would be the big three that women suffer from. And so we've got our sort of target range where we can sort of triangulate between dosing, clinical impact, and laboratory testing. And I think you can do that in a way that makes for a reasonable model. And when you start over and you try to build that model with saliva testing, which a lot of people do, you cannot do that. Like the data just doesn't align with the creams and the gels in particular. And that's a story you're probably familiar with, where when you put a hormone on your skin as a cream or gel, the saliva has this weird exaggerated response that half of our world has rejected and half of our world has strained so hard to make clinical sense out of. And I used to be there. I used to lecture and say, hey, this makes sense. And as I started to dig into the data just completely aligned with the opposite story. And so I have discarded that. But our world of functional medicine really struggles with, to be honest, just being honest about what the data says so that we can progress towards, best practices for those scenarios.
Yeah, you can sometimes get really fixated on your beliefs, I think. So if you believe wholeheartedly that saliva is the way to test, then it's very hard to convince yourself otherwise. And so that's certainly a challenge. And
Well,
so,
I would say too, there's an origin story there
yeah,
that justifies the position before you scrutinize it. And that is, you go way back in time, people are taking progesterone creams and estrogen creams, and nobody separated estrogen and progesterone because their responses are different. So then what you get is with the progesterone cream, which you really shouldn't use because the evidence doesn't support it, but what you end up getting is you get no response in serum. And a lot of these women feel better. So then you have this conclusion that's confirmed by all these stories that says blood testing is wrong, and you see the saliva results moving, so you think there's got to be truth there. It's kind of that simple of a story. And so people chase that for 20 years, but as you pick those apart, treat the hormones separately, and really interrogate those conclusions, you realize there's no substance to that. And the truth is more nuanced. It's different per hormone. And you have to really work your way through those conclusions in order to end up somewhere where you have a reasonable position that the data is in alignment with.